And joining us now is our own Dr. Jennifer Ashton. Good morning,
Good morning,
Jen.
Debbie.
I've got to think that a lot of doctors have hesitations about this and the internet because there's so much misinformation out there. Is this a case of if you can't beat them, might as well join them?
Well, it probably is, Debbie, and I think actually it might stem from a lot of the frustration that patients feel because there are so many inadequacies now in the modern relationship that they have with physicians. Physicians just don't have the time to spend explaining things that are very complicated that they did in the past. And I think this is what's come out of it.
And have you seen that in your own practice? Is this pretty common? People are consulting the internet along with coming to see you?
Absolutely. We're seeing it more and more, of course, either for a second opinion or for the first diagnosis. But again, you have to remember that most medical education and training takes about 8 to 13 years, and that knowledge is not all that being a good doctor is. There's experience, there's judgment. It really is an art and a skill to practice medicine. So when patients go to the internet, they have to realize they are getting knowledge, they're getting information, but how to apply it to the individual is where the art comes in.
I got to say, this kind of sends a cold chill up my spine, but is this the Is that the wave of the future?
It probably is. And in general, I think knowledge is power, and we want a more informed patient. That ultimately will only be good. It's just that people need to realize that if they're going to take the responsibility for educating themselves, then they might also have to take responsibility for treatment, and that's where we need to draw the line.
I got a feeling we'll be talking about this some more in the future.
We
Dr.
will.
Jen Ashton, thank you so much.